Hi there. In this video, I'm going to show you how you might process pathology outcomes from our reports, particularly if you are tasking patients to either their usual GP or might be one particular clinician. Different practices work different ways, and so we've tried to build the system in a way that you can use it the way that you want it to work. So if I come here, for example, in clinical reports to pathology and our TFT page, now one option with all of these is to say all of these will always go to an appointment with a GP or a nurse practitioner. But often, actually, it depends a lot on the individual patient. An appointment may not be needed. A notes-based review might be fine. In some practices, it may be that one clinician, say, works through these reports, but often clinicians aren't very familiar with clinical reports and they don't necessarily need to be. So what a lot of practices choose to do then is to task clinicians to ask them to look at these patients. So if I come to this header report, clinical review, there's only 5 patients in there, and that's basically the 5 patients that are appearing in this list. It may be that you want to send different results and different outcomes to different people, but it's more likely, I think, that you'll group them all together. So right-clicking on here, you can go Actions, and I think most likely you might use Send Tasks to GPs, and that will generate a task for each patient in the list and assign it to their usual GP. However, for this demo, I'm going to use this one, mainly because when I tried the other one, it brought up the patient name. Not ideal for a demo video. In here, you could use presets, and if it was me, I would probably write a preset so I can just go back to it. So something like, please review latest TFT using TFT template, pathology template. Please use the template to review suggested actions and record the outcome. I don't know, something like that. It's not something we can do for you, unfortunately, because presets can't be published across organization groups, and nor can task templates. So anyway, once you set these up, that's very simple. The advantage of this approach is that rather than trying to put in the task the detail of what's the outcome, what we're trying to get clinicians to do is to use the template, because the template will give them the information they need. And not just for example, one common one is things like, we would normally prescribe this, but we can't because they're in some kind of exclusion. What the template will generally do is also make it really clear, this is the code or this is the result that means we're not sure that we should be prescribing this thing. Also on the template, they can record the outcome, either to say it's been reviewed, it's been done, nothing more needs to be done now, or the clinician might say, I want this patient to have an appointment. Either way, that will kind of move them on to the next stage. So anyway, in here, I could pick a group or a staff member, and I would click OK. I'm not actually going to do that now because it's not what we do in our practice, but that's the way you would do it. Yes, I am sure. The next bit would be to add these 2 recodes. And again, I'm not going to do this, but I'm just going to show you. So I go Actions, add recode. Let's just move that down. And what I can do is I can just literally type in the code and press Tab. It's the letter T for TFTs. We've had to use slightly random codes to make all this sort of stuff work in the system. And then there's also the one for in progress, which does make a little bit more sense. And you could note like task sent to usual GP, so that it's clear in the record. Once those 2 codes have been added, the following day, the patients would no longer appear in those reports. And you perhaps just do that maybe once a week to kind of say, right, these patients need review. Those patients won't drop back into these reports again until they have, if they have future results that need the same review. But if for some reason, say a task gets missed or deleted in error, or perhaps isn't reviewed properly, patients would then drop into this report 4 weeks later. And there you'd be looking into individual patients. You might be looking to see, has the task been completed, but just not outcomes put on the template? Has everything been done appropriately? And the idea is that just helps make sure the loop is closed and no patients get missed. Clinical review is perhaps the most likely thing you're going to use that for, but you can do it for other sections like discussion requested by patient or medication to change. And again, what we've done for each of these is in this header report, it includes the patients in the sub-report and the codes to add. And then if they don't respond or it doesn't get done, they drop into these reports 4 weeks later to review. Hope that makes sense. You can do it as well on an individual patient basis, but we want to make this as quick and slick as we can. So we think that this is the best approach if that's the way you want your results to be reviewed. Thanks.